Our group researched the question, does high intensity exercise have more successful outcomes than LSVT BIG therapy and functional gait and balance in patients with Parkinson's disease? First of all, Parkinson's disease is defined as a neurological condition and progressive disease that gradually strips away motor abilities. Our group researched two interventions that are commonly used to treat Parkinson's, and it includes LSVT BIG therapy and high intensity exercise. Our research aims to determine which intervention yields better outcomes in gait and balance with Parkinson's disease patients.
The participants that we looked at were Parkinson's disease patients at unspecified stages, and they're evaluated with other PD patients or patients without PD. And the way that we found our research, we used databases Medline, EBSCO, PubMed, and Cochrane database of systematic reviews. And there was a lot that popped up, so we narrowed it down using keywords, which are listed at the bottom, and also narrowed it down based on year. And ultimately, we narrowed it down to 3 articles referencing high intensity exercises and 6 articles referencing LSVT.
A variety of outcome measures were used to determine if high-intensity exercise or LSVT BIG therapy had any effect on the symptoms of Parkinson's disease. Some of these included the non-motor symptoms assessment scale for Parkinson's disease, the MDS Unified Parkinson's Disease Rating Scale, and the TUG test.
For our results, we found that short-term outcomes were similar for both LSVT BIG therapy and high-intensity exercise, meaning they were both beneficial in treating Parkinson's disease patients. We found improved tug times and improved balance and postural stability, and the literature showed that there were more consistent frequency of exercise for LSVT BIG compared to high-intensity exercise. We found that further research needs to be done to directly compare these two interventions.
So there were some limitations to our research, one being none of the studies had qualitative data. There were many studies with low levels of evidence. There were no studies with direct head-to-head comparison between high-intensity exercise and LSVT BIG therapy. There was no blinding in the studies, and they were not stage-specific to the specific stages of Parkinson's disease. And only one study mentioned a longitudinal analysis, which was a 6 months follow-up.
To conclude, the primary aim to this research was to determine which intervention, LSVT BIG therapy or high-intensity therapy, yielded better outcomes in gait and balance in patients with Parkinson's. Based on the evidence, no conclusions could be made whether one of the interventions was more successful than the other. Overall, short-term outcomes were similar for both, being beneficial in treating patients with Parkinson's.